what that meant, what that line from opposition to marijuana reform is fundamentally about is scaring parents, particularly women of childbearing years. The segment of the voting population that Bill Zimmerman 2 panels ago mentioned was so key to the future of this issue and victory of the next initiative. One of the things that we saw in this last campaign was the organizing of parent advocates, parents who actually step up and say, we're parents, we believe that the solution to a lot of the issues that face us as parents is actually the repeal of marijuana prohibition, the ending of the drug war. One of the most visible figures in our state is Gretchen Burns-Bergman, who's the executive director of A New Path. Please join me in welcoming Gretchen to the podium.
Well, thank you all for being here and for being here right now, because it's a long day and it's been a cold day out there. I've kind of been freezing in the audience, so thanks for being here. I've really learned a lot from listening to all these different perspectives, and it really helps me formulate my arguments when I move forward. So thank you for being here and being part of this. A New Path stands for Parents for Addiction Treatment and Healing, and it's an organization that I started with a couple of other parents in 1999. And our primary focus was for treatment instead of incarceration for nonviolent drug offenders. We were all parents whose children had experienced addictive illness and who also experienced the devastation of dealing with the criminal justice system. I had a son that was in prison for marijuana possession that started a 10-year saga of going in and out of prison, and tremendous painful journey for our family, a waste of human potential, and certainly a waste of taxpayer dollars. And felt that I should stand up and start speaking out as a parent, because I knew that there were other mothers who just were sort of keeping this as a dirty, dark secret, that their kids had an addictive illness or that they had become involved in the criminal justice system. So in speaking out, I found that so many other mothers were given the permission to speak out. And we just grew and grew and grew. It's amazing. But one of the first things we did was we realized that we weren't even viewed as a stakeholder in this problem. The criminal justice was fighting with healthcare about who was going to take care of this situation. And we felt that the parents who had been dealing with this day in and day out weren't even asked to the table. So in typical Gretchen fashion, I decided that we should invite them to our table, since they wouldn't invite us to theirs, and sort of pulled them all together and started having them listen to what the parents had to say. And I was always focused on this therapeutic justice. It moved along to more harm reduction issues, that sort of the parents' right to nurture. I sort of rebelled against tough love and that whole, and sort of dropped them, let them hit their bottom, and realizing that my son, who was a heroin addict, would die, that would be his bottom. I felt that it was important that I did step in and just try to change some policies and laws in regards to addiction. Last year, in 2010, I was at a Drug Policy Alliance conference, and Marijuana Policy Project had a slide up on the screen with a mother from the 30s holding her hand out and holding her children to her breast like this. And I thought, wait a minute, I've got to do something about this. So we started this campaign. I was going to call it Parents Protest Prohibition, because that's what it felt like to me, but in order to engage other people around the state, we went with a sort of a tamer, Moms United to End the War on Drugs. And we reached out to other groups of mothers who had lost their kids to overdose, and certainly a lot of parents who had lost, their kids had lost their rights, their human rights to incarceration. And I realized that I had a story to tell, because in 1990, my son was arrested for marijuana possession. 20 years later, marijuana arrests were up 127%. So we campaigned throughout the state, most of us, for Prop 19. And now we're moving it to a national level. I think the question that Stephen asked me to address was, what will it take to get more parents on board? And I think that bringing this to a more national focus and having parents step forward throughout the nation is going to help change the overall climate. Certainly we've already done that with Prop 19 and the efforts, but I think that if we can continue that conversation forcefully throughout the nation for the next, until the election of 2012, that's going to help a lot. But I want to share with you what the arguments I hear from most parents are. Moms listen to doctors, they listen to judges, and they listened to the federal government. They were very scared when they thought the federal government. I think that they already believe that we should legalize marijuana. I think that's already there. It's more of a question of having permission to speak out. There was the fear that they would sort of open the floodgates to widespread marijuana use, and then that would be the gateway to widespread all drug use, and that we would just sort of expand our problems. So that's a big question to address with them. That's one of the languages that we have to work out in addressing that with parents. It's mostly getting them to step forward and speak what they know to be true, because 1 in 4 families is dealing with addictive illness, and look at how many people are incarcerated because, or arrested and having their liberties taken away from because they have a drug arrest on their record. So most parents already know, already feel. They just need more permission, more tools to speak up. And I think that if we could get those professions of certainly LEAP helps, the clergy helps. I think that some of the people who are addictive medicine doctors need to speak out as well. I know CSAM does somewhat, but I think more so, and that gives the parents permission to move forward.